All right. Okay, so welcome back, everyone. And thank you, Divi, for joining, and Iris. We're going to continue where we left off. I do want to welcome everyone to share questions in the chat. And maybe towards the end, we'll open up, everyone can, if they'd like to speak up and ask questions too. We'll start off with less slides this time, less questions, have more of a discussion. I know it was a little bit rushed last time, so we'll keep it to 10 slides. Um, and I wanted so where we left off last time, there was a question in the chat. Um, I've been battling an eating disorder for years, up and down, on and off, and I want to, and the question was, when will I be done with this? And we didn't get a chance to address that too much. So I wanted to start there, um, and then move on to some other topics like meal coaching, diagnosing an eating disorder, um, and what, a realistic timeline when it comes to healing or recovery, different levels of care. And so yeah, and we'll keep an eye on the chat if there's any questions there and try to address that as we go along. So starting with the question, so what is a true healing? We had this question a little bit last time. What does it mean to really heal from an eating disorder? Um, Mentally, emotionally, spiritually, and physically. Um, what does it really mean to heal? And so where to start, right? There's sometimes we can get really caught up in the ED voice and the intrusive thoughts. That's a really big part of an eating disorder. There's the having emotional space for other things and not just being fully focused on the eating disorder. Spiritually, like what is it, kind of understanding the acceptance or the fight, um, and then also the physical part. That's really important to address and to know. It's not just about like finding the will or finding um, the feeling like it's over, but sometimes there's some physical. We're talking about maybe there's um, being in touch with a medical team, a doctor. Sometimes there's different probiotics and there's different medications or vitamins to think about also in the long term when not too long term, but in the recovery process. So where should we start? What does it mean to recover? Um, what does true healing from an eating disorder look like?
Do you want one of us to answer,
Yeah,
Shlomo?
yeah, let's yeah.
Okay. So in my experience, it's different for everybody. It's taking some of well, we always start physically. Physically, you have to have medical safety, right? And that's the one thing that doesn't look different for anybody, right? Your heart has to be beating well. Um, your vital signs have to look good, which is heart, obviously. Blood work has to look pretty decent. And there's some really significant clinical parameters that fall into the physical part. And we always know that that's the part that will hospitalize you right away, as well as that is a big piece of what recovery looks like initially, because it doesn't really matter if you mentally feel well if your heart is giving out, right? So, you could be emotionally and spiritually balanced, but it doesn't look good, sadly enough, at your gravesite. So medically, it's really, to me, primary. And then come the other three. And I think depending upon how people see mentally, I think emotionally and spirituality fall a little bit under mentally. Um, but I think that could look different for each person. And we have from people who function with some level of physical safety, but they'll always have some thoughts in their head they're battling, to some people who truly believe that they're 100% fully recovered. So I think that's between the person and the therapist. And we always say, like, if these boxes get checked off for you after you're physically stable, then we're going to put you at like level 1 of recovery, and then we'll go to level 2 and 3. But I do think on that piece it looks different for each person.
Mhm.
I don't know, Divi, if you could add to that.
Sure. So healing is a big word. So I might translate this as true recovery. Like, what does true recovery look like? And of course, there's so many ways we could explore that here together, but something that comes to mind is when whatever the eating disorder was managing for the person, like whatever um, um, emotional or internal distress, those behaviors like restricting or utilizing food to soothe, whatever, once those behaviors don't no longer have to manage the pain the person is carrying and they have healthy ways to experience that pain and hold it in their lives, whether that's through supportive relationships or healthy coping skills, when the eating disorder can be unmasked and the person can experience their distressing emotions in other ways, then that's true recovery. And true recovery is a lifelong journey.
Hmm.
I don't know that we want it to end, but we hope that it will be with more ease and less painful.
Hmm.
Mm.
Mm-hmm. Mm-hmm.
And I think it's important also to talk about sometimes in early, we'll talk about trauma a little bit, but sometimes there's a bit of a fractured self. There's the reason why this eating disorder part had to step in and kind of sometimes present as a bully or we're running the show now. It's because sometimes things were very chaotic or didn't make sense at a young age. And sometimes, as one heals and recovers, there's less numbing that happens and there's less dissociation and suddenly there's the individual can feel that pain and feel that chaos and have the maturity or the ability to really sit with those feelings and when that happens there's less of a need for that ED part, the eating disorder part, to be so involved. um, and that can be a slow process. So definitely like the physical recovery part, and this everything else might come more slowly. Um, and
Right.
yeah.
Also, another way of looking at that is the physical changes that need to be made, like helping somebody find some balance in their meal plan, may happen earlier than the internal changes
Hmm.
where a person actually feels a sense of confidence in themselves and feels comfortable in their body and feels really embodied in their body as it is. And so those gains of recovery, like those rewards of the real internal shifts and the internal peace of mind that are possible, may just take longer to get there because that requires a capacity to also go deeper into the psyche and inside oneself and to find the ways to experience peace of mind
Hmm.
in a body.
Right. And
Right.
sometimes, that can be more intuitive and that can be, waiting until the individual is ready. That the physical part, sometimes we can't wait. If there's a medical concern, has to be addressed and it has to, sometimes it's very uncomfortable. Sometimes the restoration of weight or whatever it is, stopping certain behaviors that are harmful. Sometimes that has to happen now. When it comes to uncovering or kind of exploring what the maybe trauma or what's really motivating the eating disorder behaviors, there's always like I guess we can call it a risk. We'll talk more about what it means to work with trauma. Um, and there's different ways of doing that. If it's EMDR, if there's different ways, different types of therapy. Um, but that definitely can be done more slowly and when the individual is ready to see that and to work with that.
I just want to add one more thing with this slide. I'm just a little concerned about the word true healing versus, I guess, false healing.
Hmm.
But, I'm just concerned because perfectionism is such a personality, um, you know, uh, quality to many of the people we work with. And true healing doesn't mean perfect healing, right? It's not the opposite of false healing. It's basically more saying true healing to what it looks like for you.
Hmm.
But like Divi said, healing is like a lifelong process. And, you may have healed from being a high school girl transitioning to seminary, but there may be more work to do when you graduate seminary, becoming a married woman with children.
Mhm.
And even though you think you perfected friendships with your friends socially as a single girl, what does it look like as a mother of two children working? Throughout the stages of life, true healing is using the skills that you're working with to apply them. And if they stick and you can use them from one situation to another, then that's a good sense of healing. But I just don't want it to look like perfectionistic. There's plenty of times where someone may feel like, oh, I'm slipping. But if you have the tools to acknowledge it, have the tools to look at it and either reach out for help or know how to maybe try to handle it on your own, that's part of true healing also. It doesn't mean it comes with perfectionism.
Mhm.
You
Yeah.
know, it's learning how to navigate life and reaching out when you need help. And, true healing is plenty of slipbacks.
Yeah, I feel like once a person really internalizes the compassion of others, meaning at first you might reach out for help and you might feel like this eating disorder is such a mess, it's ruining my life, I'm so overwhelmed. And at first your, therapist or whoever it is that you're working for with your practitioner is going to hold compassion for you and how this has evolved to help you in your life and the impact it's had on your life. And once you start to internalize that compassion and actually feel not just the word compassion, but actually feel some genuine compassion toward yourself for needing these behaviors to get you through and for the imperfections of your life, because everyone's is imperfect. As you start to actually feel that sense of compassion on the inside, your true recovery begins. Meaning, right? True, not as opposed to false, but true, meaning real for you,
Right, exactly.
visceral for you. You can feel it. Yeah.
In Tanya, there's a reference of true tshuva or true service of Hashem is kind of like a similar type of thing here. It's like it's true for the moment. It's true in the sense where you're being in touch with where you're holding in the moment, but it's always more true as you move on.
Right. And I will say the truth, the place I like where the word true is that eating disorders have such a high level of denial.
Mm.
And, that anosagnostic like component to it that says so many things we could sort of wiggle through. Like it was only one meal I missed, like I really deserved to that was a really hard time. True healing means like you're actually staying truthful to yourself as well,
Mhm.
and so
Yeah. When you start to define your life by values, something that is more than your eating disorder, and you stay committed to that, of course, with all the pitfalls and real life bumps in the road.
absolutely.
Yep. Okay. Good.
Let's just say that physically, it's when your body is no longer in a state of chronic stress from malnutrition, and malnutrition can come from simply not getting enough nutrients in, and it can also come from not having enough diversity of nutrients.
Correct.
So just to say that across the spectrum of eating disorders, the body can be in a state of physiological strain, even if it's not obvious based on appearances.
Mhm.
And so when
That's true.
when the body is no longer suffering from the added strain of malnutrition, then we might say that physically there's a process of recovery underway.
Mhm.
And I'll just add to that physically doesn't mean that a doctor says that your vitals are okay, so therefore you're okay. Meaning the body has an incredible way to adapt to starvation. And a lot of the clients feel that, hey, my vital signs are good. They sent me home from the ER, and that does not represent true healing.
Mm. Right. I guess a big sign is if there's space. So mentally, if there's space for other things, how often do our intrusive thoughts about calories or about appearance or about weight, is it there all the time, or is there space for other things? Emotionally, can we connect with others? Is there space to connect with others? And is there um, physically? Can we also just maybe mention a little bit what sort of things can one do? Let's say they're past doing well in recovery and restored whatever weight if that was something they had to do. mentally, let's say they're doing better mentally and emotionally, are there things to do physically? Any supplements come to mind? Any things to recommend just in this space?
I mean, I'm going to pass on any supplements or anything because that's sort of like, to me, I don't know each person's story, what they're on, or, what their medical, but physically in terms of activity, once somebody is considered physically stable, we always try to add back in some level of, um, you know, physicality there. We don't, of course, we have to take into account if someone was an exercise, bulimic or did anything physically that was dangerous. And then we have to sort of let activity come back in slowly. But there's always room for movement, gentle movement. Um, So yeah, I mean, physically, we didn't address, like, I have clients who lose hair physically, and some clients lose hair while they're becoming malnourished. And oddly enough, it seems like that shouldn't happen, but I have more people who lose hair when they're weight restoring and they're actually in the best place that they've been. And they really haven't, to my knowledge, came out with like some type of reasoning for that. I think I once read something, and it's not sticking with me. But interesting enough, like, why would we lose the hair once our body is now getting more and more nourished? Maybe, Divi, you can answer that if you remember. My brain's like a little bit tired right now, but usually I see it after while they're refeeding.
I don't have an exact science to respond to that with. And also, there is in the beginning, the body is in such crisis that
Mhm.
it's really intelligently responding to essentially emergencies. And a lot of times, as there is actually more nutrition on board, you'll actually start to see some of the adverse effects of the starvation that came before. It's almost like the body now has some resources to work with, so it's cleaning up,
That's
right?
true. Yeah,
And
that makes
that's not an exactly scientific response, but that may look different for different people. It could be hair loss, it could be feeling low energy. It could also be mental health issues that show up later. Like as a person is actually doing better than ever with their eating, they actually feel more depressed. It's almost like there's a chance to catch up on some of the things that a person just had to go through in survival mode from before.
Yeah.
Mm.
Yeah, I mean, we've had some families say, my daughter, she's refeeding lately and she's mentally in the best place she has been. And on one end, it's very true. And on another end, we find out that they're secretly using the eating disorder or doing something. And it actually you can watch for that as a sign of relapsing
Mm.
because they're back into the drug and they're higher than ever,
Mm.
Right. Mhm.
So, you know, again, I hate to say that I don't want anyone on the call who's listening that their loved one is actually doing better to think, oh my goodness, are they actually secretly doing something wrong? Because no, but as a practitioner, we definitely see both ends of it.
Mm.
Yeah, and also the other side of what you're saying is maybe very important for people on the call because if you or your loved one is struggling more emotionally, doesn't necessarily mean that progress isn't moving in the right direction.
Mhm.
So
True.
I can think
Yes.
of examples where, let's say, the family gets new insurance to pay for residential, and then the person comes back and it's like they seem more depressed than ever. What good did it do? But that could be a natural part of their process
Right.
that they're actually able to feel those feelings now.
Yeah.
And it could be make big game changer if the people around them are willing to see it in that way and be supportive through it.
Yeah. Yeah. It's definitely really important where, a parent or a spouse or someone can be like, can connect. Maybe in the past they weren't able to connect emotionally and be empathetic and really understand what their experience. That's maybe that if sometimes when someone goes to residential, that's the work that they can do as we'll talk more about support, but as a spouse or as a family member, to be more available and open to kind of listening and being there for them emotionally. And then before we move on to the next one, also just to mention hunger cues, because hunger cues can go away and that can be very confusing. And then in the recovery process, it might still take some time for the hunger cues to come back. I thought to mention, I definitely every individual is unique, and they should discuss this with their dietitian or doctor. But there are things like omega-3, or there are some probiotics or things to kind of heal the gut, and that's an important thing to think about in the
Right.
recovery.
There's an amazing, I think he's very interesting and always worth looking into. His name is Dr. James Greenblatt, and he's a psychiatrist that specializes in functional nutrition,
Right.
psychiatrically. And again, I'm not promoting him, nor am I denying him. I'm just saying, he really takes a good look at the nutritional intake and the vitamin and mineral status of his clients, thinking that some of the residential centers will have people eating Twix bars and cookies, and which are all great because all foods fit in the recovery process. But he does believe that 80% of your food should come from wholesome foods to heal the gut.
Yeah.
And he does do a lot of supplementing with a host of vitamins that some of them are really worth taking a look at.
Yeah.
I'd also like to draw attention, because sometimes in these conversations we focus more on anorexia.
Yes.
But also we know that bulimia and binge eating impact people's lives very much. And this component of it is just as real in the binge end, where what I've heard often is that the person is doing so much better and feeling more empowered, but the cravings just are louder than ever. And again, you can see that kind of painful lag where actually, because you're taking steps in the right direction, you're actually feeding your body, your brain is actually more active. And now the cravings, your body's like, oh, I'm getting some of that nourishment I really want. And the cravings are even louder. Almost always that points back to some way that your body is letting you know that it's still looking for something.
Right.
And
Yeah.
what it's looking for can be a micronutrient, right? It can be invisible to the naked eye. So you may end up working with a practitioner with supplements, but the general rule is to increase diversity of your
That's
intake.
right. That's right.
Because if you keep paying attention to your body and you keep increasing the diversity of the intake, over time, you'll actually meet your body's needs. So the cravings may be frustrating, but it's really your body reminding you to stay on track.
Right. Yeah. I also think that there's a lot of hormonal dysregulation when your body goes through any eating disorder. Again, like Divi said, whether it's binge eating or bulimia, anorexia, ARFID, your body goes through, I mean, you don't want to get too technical, but every stomach and everyone's fat stores and everyone's pancreas provides certain hormones that become very imbalanced during the eating disorder, while you're heavily into the eating disorder. And then once you start to recover, the body's trying to rebalance itself hormonally. And as it's doing that, some of these hormones may be wonky, giving you some like scary symptoms. And you just have to like let them play out and stay on track, or encourage your loved one to stay on track, because over a short period of time, these hormones will balance each other out. But you may just have to go through the rain before you get to the sun. But usually, that creates like a slippery slope to say, I don't like the way I'm feeling. But we just have to help our clients stay on track in that time.
Yeah. Yeah. And that part takes more time. So it was definitely important to differentiate the different things we're focusing on. And maybe we'll talk more about ARFID. I don't think doesn't get mentioned enough. I think when we talk about eating disorders, ARFID is avoidant restrictive food intake disorder, where it's really not about body image and it's not about calorie counting. Usually it's for some reason it's difficult to eat, for fear of choking, fear of getting sick, textures and things like that. And often there's a lot of malnutrition there. So just as important, the healing of the gut um, and balancing all the different nutrition levels. Yeah, so we should move on to the next one, I think. Let's go to the next one. Um, this is also really important, diagnosing an eating disorder. Um, this is, often your friends will call up and say, this seems a little bit disordered. How do I know if it's an eating disorder? Sometimes someone, ask for themselves, how do I know? There's the famous, that book, Am I Sick Enough? Or Sick Enough it's called?
Thick enough.
Sick Enough. So how do we diagnose it? I don't want to go into the specifics, like exactly, but what are some early signs? What are some things to bring focus to here? If you have a family member or even, oneself to know, is it time to get care? We're going to talk about the different levels of care. But what are some important things to think about when we think about diagnosing an eating disorder? Either of you can start, I guess.
Divi, you want to start?
Well, to me, by the time we're having this conversation, it's already late in the game.
Okay.
If you're already talking to a practitioner about a potential diagnosis, it's already pretty late in the game because what is the standard we're measuring against?
Mhm.
In my hope, it would be real embodiment and real peace of mind in relation to your body and to food in general. And in a sense, we all have work to do in that domain, so it's a spectrum. But I think when we get to a diagnosis, it's really having a noticeable, observable impact in the person's quality of life.
Mhm.
So that's generally how we define something that meets diagnostic criteria, is that the distress is impacting and interfering with their level of quality of life and their capacity to function in relationships and in work. So that's really the kind of threshold we'd be looking at. What kind of impact is this having on a person's capacity to function as a person, to feed themselves, and to work and to be in relationship with others?
Mhm.
Yeah, I also think, again, going back to the physicality of it, um, most parents, when your kids are living at home, I mean, obviously, if they're not at home and they develop one, that won't be as easy, but you do see early signs of weight loss, significant changes in how they're eating. Some people decide that they're going to start eliminating food groups. Um, they either gain, I don't want to leave out binge eating. So they gain a significant amount of weight, they lose a significant amount of weight. Sometimes they're more tired than before. Sometimes they're doing way more activity than before. They're, like Divi said, there's noticeable changes in who they were before versus who they are now. And to me, those are the flags that, I look for. I also look at the head that you said before, Shlomo. It was like, if the average woman or person lives above the lip in how much they look at themselves, or they have room for other people in their life and connection, etc. And then we have a little bit of eating disordered here. Once it hits the top of your forehead down, and there's no more room for anything else except your obsession with, this issue around food, your body, or medical safety with RFID and restriction of food. Once it hits here, either to a loved one who sees it or to the person, you need help. And I think you should reach out a little earlier. But for the most part, I give parents a lot of credit. Once they reach out, they know something's wrong.
Right. Well, part of of this Zoom and in general is the more we can prevent, the earlier on we can catch it, the bigger difference, the better it is. And some signs to look out for, if we do ask a friend or family member, if we're noticing some isolation, noticing even some self-harm, that can be like a real tell, if there's self-harm, any sort of self-harm, even if sometimes cutting and something like that. Or even talk about self-harm, like punishing oneself. That sometimes that comes along with an eating disorder. Rationalization, sometimes we all do things that we're not proud of or we regret, but we can have a conversation about it. Sometimes there's the rationalization or the denial. can also be a big something to really focus on, and that really shows something is a little bit needs more attention. Yeah. All right. Should we move on? Anything else? Okay. Um, meal, meal coaching. This is something we're working on writing something up about, and this is really fascinating concept of meal coaching. And when I started, I'm sure both of you have a lot to share about meal coaching. When I started at Walden, like maybe 6 years ago, I remember they said go into the room and meal coach, and I remember in the room there were a bunch of really bright individuals, PhDs, and my job was to say, can you have a few more bites, or can you I felt pretty awkward doing that. But the truth is, meal coaching, doing it the right way, and it can go wrong. It can turn into like a power struggle if you're a little bit too pushy or too challenging. I would say so. What I wanted to do was to break it down to when. So there's meal coaching before the meal starts. Sometimes even plating and choosing what to eat can be really challenging and really difficult. There's during the meal, which to pay attention to intrusive thoughts and how to go about that and how to address those thoughts and how to have the right amount of distraction. And then there's also afterwards, after the meal, sometimes that's when the intrusive thoughts really pick up. That's when there's maybe some panic. I ate too much? And that's when the spiraling starts. So first of all, knowing when and what the goal is and what we're doing with the meal coaching then. And then what is our role? Who is doing the meal coaching? Is the goal, depending on what the diagnosis is the goal for them to complete the meal, or is the goal to have a challenge food, or to have a food which is really difficult and to have a few bites of it, or to even sit with their feelings during this meal? So I think it's to be very clear about what the goal is, and there's like a delicate balance of being playful but firm, being I think that's kind of like the tricky thing is how to be very firm. This is what has to be done. This is what the goal is here, and then choosing a game or a distraction and talking about ideas when it comes to that. So, want to go next, Iris?
So I ran and still run a meal coaching practice. I had five meal coaches as of 2 years ago. I'm down to two. And one would say, why is that? It's because I think that is harder than any session that a practitioner can do with a client.
Mm.
It is a hands-on experience that, unless obviously you're living with somebody who you are actually meal coaching every day as a parent or a loved one, I think everything you said, Shlomo, is pretty accurate. There's so much that goes into it before, during, and after. But you're right. You have to know, like, what are we looking at? And we'll go back to the first slide. Like, are we in a place where the physical needs need to be met? Parents don't want their child going to the hospital for a second time. Can we keep their weight 2 or 3 pounds above so at least they could like be in therapy and be home, and not go to residential or just stay in PHP? So sometimes it's just a matter of numbers. And can we get that in? I haven't found that the meal coaching on the first go around with any of my clients that we picked up actually was the savior to them not going into residential. I think sometimes this is all before. I'm not saying once someone comes home from residential to carry out to do relapse prevention and to carry out what was carried through in residential or PHP, but just to keep them out before. I find it really hard once the parent comes to, like Divi said, when they come to, it's too late. You already notice they're deep dark into their 20-pound weight loss. They're not eating. And it's not an easy thing to get someone to eat. You're not taking something away, like don't smoke the cigarette, don't drink the alcohol. This person has to put a fork or spoon into their mouth. They have to swallow it. I mean, I could be on a call with someone eating 1 slice of cheese for 3 hours. It takes the patience of a saint to do it outpatient. I've never done it inpatient. And And then there's meal coaching for ARFID, which is a lot easier on certain degrees, depending upon the client, which it could go from terrible to a teenage boy whose mother just wants him to eat spinach, and where, he's willing to some degree. And then we do a binge eating where we'll follow the people into their home, actually, and they'll drop their keys on the counter, come home from work, and we'll stay on the phone with them for the hour that they would usually go into the refrigerator. And we do more recovery coaching, and we walk them through that dark part of their night, and we'll provide them with a coach in that area. So, and we do the before, during, and after, like how you feeling walking into your apartment, how do you feel being there, how do you feel? So meal coaching is really pretty interesting, but it's a lot of work.
Mm-hmm.
It's a lot of work.
Yeah. Yeah, I like how you covered a lot of important to really think about the different diagnoses. And Divi, were you going to say something?
Well, haven't done a lot of meal coaching. It is a beautiful opportunity because I feel like in a lot of the work we do, we're spending time with people and we're holding space for their emotions and their process, but to bring food into it, I've done that sometimes. But it kind of makes it real and it gives you a chance to really see in real time what is actually arising for people as they sit with the food. So to share that with a practitioner can be intimate in a positive way. It can help with creating bonds with people around food that are different from what's inside the eating disorder or what came before in the past. So in a certain way, meal coaching is being together and infusing that experience of eating with all the things that the therapeutic principles like compassion and openness to different emotions and curiosity about slowing it down and seeing what arises and seeing if we can make space for that, but not in a way that is totally overwhelming. So having someone who you already have some trust with, actually allowing them to follow you into the meal can be a very important step. And it does take a tremendous amount of patience. And some of the programs are focused on really just teaching parents how to say the right thing and take care of themselves during meals, because that in and of itself can have a really profound impact.
Yeah. Sometimes there's what not to say, that can be really upsetting. It's like, pointing things out, staring. Sometimes eye contact is very, very frustrating to be watched the whole meal. At the same time, we don't want to back off too much and just kind of let it slide, but to be firm. And I want to say that it's really important. There's different stages of recovery. So there's the beginning of recovery. There's something, I don't know if we'll get into the FBT when it's more like rigid and kind of parents have to take control and say, this has to be done, this has to be eaten. And then later on in recovery, the meal coaching might be much more about the emotions and the intrusive thoughts. And it was so beautiful. Some sessions using like IFS, internal family system styles, there's sometimes we'll notice that there's, a client can feel really nauseous and I can't eat, I'm full. And as we just talk a little bit and say, what is the fullness? The fullness might actually be an emotion. And the more that we can kind of let that emotion pass through, if it's fear, if it's anger, if it's sadness, all of a sudden there's space and there's space to eat. And sometimes that can happen, and which is really beautiful to see, but it really depends where someone is holding.
Yeah, I will say that any advice to any of the people on, at the beginning, if you're not going to meal coach 3 meals a day, 1 meal I found in my meal coaching practice, just to be totally honest, until, if you want to do 1 meal a day, 1 meal a day is really for challenge foods. 1 meal a day is really for somebody at like stage 2 of refeeding. But if it's a physical refeeding for medical stability or to stay out of residential or a higher level of care, you have to have all three meals because the girls are absolutely master, or boys. I don't want to exclude, I just do it mostly with girls. Master manipulators that if you do breakfast with them, the family will have a hard time getting lunch and supper in. If you're going to do supper, they're going to give you a hard time at breakfast and lunch because they have to wait to make sure they please you at supper. So there's a lot of manipulation. I feel that the 1 time a day meal coaching is not as effective initially. When a family calls me, it says, well, do you think you could eat lunch with her? It's like, yeah, what are you going to do for breakfast and dinner? Many times the family you say, I'll be there. So that's great. But each meal has to be supported at the beginning. So if not, the person really will benefit from a higher level of care. I'm just saving people money on it's not easy to do one and then think you're going to get some results.
Right. Right. I
Yeah.
mean, and sometimes I'll say, so if we're focusing on the intrusive thoughts and the emotions and that part, can we choose a time of day where it's the most difficult? If it's dinner time, if it's breakfast, or that, so that's something to also. So yeah, there's so much that goes into meal coaching, and to know what we need, what the individual needs at the
Yeah, I
time.
mean, Shlomo, I gave like an 8-week program.
Yeah, we're trying to.
Yeah, yeah, and just on different levels of meal coaching. So I just feel bad for anyone listening. It's a really detailed
Yeah.
discussion in and of its own. Yeah.
Okay, good. So at least we opened up the topic a little bit
Can I
more.
ask a question, Shlomo? Like, is there anything practical you would offer people who are wondering what meal coaching means?
Yeah, I would say, well, to know what the goal is. So if it's sometimes what gets in the way the most is just planning, choosing what to have for breakfast, for lunch. So you can get involved there and say, I'll help you go shopping. I'll help you make a meal plan. Sometimes you do the red, yellow, green, which foods are easy enough, which foods are really difficult. So that can be part of the meal coaching. But I think one of the, I guess the biggest thing to point out is when we're sitting with someone during a meal, see them for who they are, and see the eating disorder as trying to kind of intrude and kind of control the situation. And can we acknowledge both and talk to the individual? So, this is difficult. You notice those thoughts happening. Can we play a game? Can we talk about something else just for the moment, and kind of to come back and say, you still have some more. Can you still focus? Have a few more bites to try to finish, and then we'll get back to the game type of thing. Yeah, good. Kind of answered. Yeah, that's a little snapshot, a little bit into what meal coaching is. We don't have that much time left, so we'll do maybe one or two more slides here. We talked about this, supporting someone in their recovery, determining the right level of care. This is also can be talked about for a long time, but it's important to know that there are different levels of care, and not to, when we confuse and be like, oh, they might be okay with intensive outpatient IOP, and that can also actually be harmful. And sometimes what someone needs is inpatient, to be at the hospital and to be monitored, and not to kind of.
Wait, Shlomo, could you, like, I don't know who's on the call, but maybe they need to know what all these things stand for.
Yeah. Yes. So inpatient level of care is at a hospital level where they, a full hospital where they have all the different equipment, and they're able to sometimes even have tubes, feeding tubes, and monitoring blood work, and if there's any medical complications. Then there's like a step down when someone is cleared from hospital level for a residential, where someone might go to live, for usually I would say 4 to 6 weeks, 4 to 8 weeks, but everyone is different. There's 24/7 care, but it's not as medical. So usually if someone is eating on their eating, but they need a lot of help, and it's also if there's any self-harm, so there's care, and there's always someone there watching and making sure that things are going okay. A step down from that is PHP, which is partial hospitalization program, which is usually 5 to 6 days a week, half the day, usually 9 in the morning, 9 or 8:45 or something, till 3 in the afternoon, depending on the program. They have two meals and a snack. There's group therapy, meal coaching, usually focused on DBT, stuff like that. And then the level down from that is IOP, intensive outpatient program, is where it's just 3 days or 3 nights a week, for a few hours. So it's one meal, maybe a snack, and maybe a group or two on skills. And so yeah, so determining the right level of care, important to involve the whole team, involve a doctor, to involve a dietitian, to involve the therapist. Everyone should be working together, because it's important to make the right call. Sometimes sending someone away for residential can actually cause harm too. Because you're taking away some supports, emotional. Yeah, so just important to really know the different levels of care and not to push off like that the decision, because it's important to make the right decision at the right time.
I also think it's important to know that sometimes you don't get to make the decision. Each one of the centers, when you make a call, they actually have an assessment process.
Right.
And you have to meet their criteria to be part of their program. And they have the ability to say whether or not they would accept you at that level.
Right. Yeah, and then there's the insurance issue too. So, a lot of hospitals will take insurance, most insurances, but then residential, really depending on the insurance, and then
Right. And then they'll determine the other factors, how long your stay is, depending upon, what their criteria is for your stay. Same thing with PHP and IOP. And a lot of centers don't take Medicaid. There are very few centers. So in New York State, if somebody's on Fidelis, there's probably only 1 or 2 centers besides a hospital that will take those Medicaid-based community programs.
I hear that is changing. I've been trying to be in touch with some of these residentials, and they said they've recently been having some breakthroughs working with them.
Yeah. I mean, I know. Yeah, me too. I've heard a few. There are actually some organizations out there, advocacy groups out there that can get you what's called a single case agreement. And single case agreements have been happening more with Fidelis and some of these Medicaid-based insurances as well. So that's a good thing, but it's just important to know. Yeah.
Yeah. And also, of course, kosher and Shabbos, and that's all when it comes to saving a life, that is secondary. But the first thing is to get the right level of care. But we have been working with different residentials and talking to them about, just some trainings in Jewish values and kosher and Shabbos, and some in New York. There's some really great ones in is it where is it, that one, in California? San Diego.
Oh, San Diego. San Diego.
Yeah, so depending on the program, they're really good. And as one of the clinical directors said, like, we know it'll never be kosher enough, but they're very accommodating and very understanding, and so that can, it doesn't have to be all. Yeah.
Just so people understand, historically there was a push to defund residential mental health institutions because they were trying to integrate people into the community and have people use outpatient services more. But this was mental health in general. So it didn't look at eating disorders and their unique needs, which is that at a certain stage in recovery, it's very difficult and sometimes impossible to do it in an outpatient basis. So that is also part of a historical picture where residentials were defunded and state insurances didn't cover residentials for mental health. So I think as people understand more about eating disorders and what the residential phase of treatment addresses and how that's different for eating disorders compared with other mental health issues like mood disorders, then there may be more allowances. But it can be very hard if someone has state insurance and needs a residential level of care. People can fall through the cracks. That can be very hard to find the right resources to get enough care.
I also think it's important to know that once you go to residential and PHP, in the frum community where it's really, you have to know a lot of these places are co-ed. They take, they're not just women only, but there are definitely some residential centers, PHP and IOPs, that are women only. So for a family that would like their daughter to be in a woman's only, then you're sort of have to look for specific centers also, or PHP. If not, they definitely will have a mixed audience.
Yep. Yeah, and the same thing is true looking for sometimes a buffer, or some boys need a place, and that hasn't been so easy finding a place. But there are programs that can kind of accommodate, maybe not have the same level when it comes to the eating disorder, but they might be able to address some other things, addiction, and it can work if you can make it work. Some of these other programs, yeah. All right, let's maybe we could do one more slide. This is a lot to talk about here, right? We only have 5 more minutes. Maybe we'll leave that one for next time. We talked a little about yeshiva and seminaries. I think at this stage, I just wanted, before we go, just to talk a little bit about realistic expectations of recovery. We talked about the different components of recovery, but some timelines. I've worked with different couples, and one client and then their spouse will come on. We feel really frustrated and they're not doing enough. And why is it taking so long? Sometimes, after a year or two, being so patient, and there's a lot of frustration there, and maybe blame. And it's important to remember that sometimes we can't rush it. We can't rush the recovery process. And sometimes a client or an individual is really putting their all into it. And what we can, encourage is finding the motivation to recover, and maybe, finding the courage and feeling to recover. But it's important for the individual themselves, as well as the family member, to know that it takes time to recover, to be optimistic, focus on the wins. If there are any relapses or lapses, I always say, like, lapse can turn into relapse, which can turn into collapse. So it's very, very normal and expected for there to be a lapse or relapse, and how to deal with it appropriately. But yeah, it can be, it's not to rush recovery, because it's not just about it's really not just about the eating. Sometimes it comes all about, like, are you eating or not? And it's really not at all simple like that.
Shlomo, it's my son actually had a friend last summer, last summer, who was actually in a very horrible accident, and he has a severe, traumatic brain injury, and he wasn't supposed to live, but thank goodness he did. But you can see how he has to learn how to speak again. He has to learn how to use his hands again. He's an 18-year-old boy who is like infantile, but has been making incredible progress over the last year. And nobody would say to him, if you just try harder, like, this could go quicker.
Right.
If you just, like, these small wins, everybody is so excited over. And then he does have some back, he had the flu, and then we went backwards a little bit, and then we come forward, and everyone just focuses on the wins. And to me, an eating disorder has a lot of brain injury. These people, strugglers are malnourished and that's why we say, if you catch it early, the recovery process is quicker than when it's not caught early, because the brain definitely goes through trauma. And not just trauma because of whatever, like we said, the eating disorder is masking, but trauma from the malnutrition, trauma from the identity that one creates. Eating disorders create their own identity so you almost have to look at it through that lens. Like, the brain is recreating itself, right? And there are going to be some setbacks, and this person has to learn how to eat again and have a different relationship with food and their body, and their brain's recovering. And I think families have to know this could be a journey of anywhere between a year and 5-6 years. And that doesn't mean that it's a light switch, that it's horrible for year one and then it just turns on and it's frustrating. It's a journey. And we always pray for it to be the quickest journey. You know, my son's friend, we wish he could wake up and all of a sudden one day his arms were moving and he could walk. But, you know, I mean, right now, we're just putting his feet on the floor. And so I think we have to look at certain cases like that. Thank goodness we don't have to look at all cases like that. But there are definitely cases that you have to look at it like the brain is in a recovery program.
Right. I think it's really powerful as we're wrapping up to just also realize that when we restore a person's agency, it's a very powerful thing. And to have an eating disorder, whatever level of severity and whatever type, is very disempowering. It really can feel like your life is very out of control. And to have a person give you your agency back, and if they're struggling to figure out how to support you, to just say, like, can you teach me what would work better for you? I'm a person and I care about you and I'm teachable. Can you teach me and show me what just went wrong or what I could do better next time? It might seem like a small thing and it applies to all of life, not just eating disorders. But what I've found is that people with eating disorders may start with a disposition that is more toward the highly sensitive to begin with. So some of the things that they're picking up on that aren't working for them might not be working for any of us. So sometimes thinking about this person in your family or in your life as having what to share with you, having what to share with you about what their struggles actually feel like from the inside out, what the relationship with you actually feels like to them, what impact your words and your presence and the state of mind that you're in is having on them, and just giving them that power back to be willing to learn from this person who's in your life for a reason is really healing, not just for the person, but really for all of us.
Mhm. Yeah, absolutely. And yeah, if there's and that was really well said and a nice way to end because it's the eating disorder behavior and it's really just sometimes the tip of the iceberg and there's so much to learn about ourselves and um you know we really just want to learn from each other, know how to support each other. Um, Last time there were some questions. I just want to encourage before we go to this, just if anyone wants to stay in touch or have any questions, to please send them over to our emails are here. Welcome to call. And just want to thank everyone for joining.
Just to know, Shlomo, my number's 362-1300, not 363. It's
Oh,
362-1300.
okay. I guess I can't change it at this moment. All right,
Okay.
362-1300.
Yeah.
But yeah, okay.
Mm-hmm.
All right, wonderful. Well, thanks, Vivi, and thanks, Iris. And
Bye.
all right, thank you, everyone.
Thank
Good
you,
night, everybody.
Iris. Bye. Good night.
Bye. Bye, guys.
For